Good morning. My name is Andy Unger. I'm the manager for the Division of Services for the Deaf and Hard of Hearing, Morganton Regional Center. We serve the community, deaf individuals, deaf-blind individuals, and hard of hearing individuals. Today, I want to talk with you about how to communicate with patients who are hard of hearing or deaf who might come to the hospital. I'll have several different tips for you to use also. I'm first going to focus on how to work with a patient who is deaf and their communication needs, plus the communication needs of their family. Let me give you some basic signs. This is a sign for hurt. You would put it in the location where the injury is. This is a sign for help. This is a sign for bathroom. So those are some basic signs for you to use when you're working with a deaf individual. When you need to get a deaf individual's attention, you could do it several different ways. One way would be to tap them on the shoulder. Tap them only 2 or 3 times, and the deaf person will make eye contact with you. Another way would be to wave. Also, you could flash the lights. Now, when you flash a light, make sure you don't do it quickly. Just flash it 1 or 2 times, and that should be sufficient. When you're getting an interpreter, you need to let the deaf individual know that the interpreter is coming and that they need to wait. The hospital has several different ways that you can communicate with a deaf individual, including equipment. There is a video relay system, which is a third-party live internet video connection. Another thing that we have is what's called a videophone. That's if a deaf individual needs to contact their family member in their hearing, they can sign on a videophone and there's an interpreter available to interpret for them. The deaf individual can also call another person who is deaf and just sign videophone to videophone directly. Both of these pieces of equipment do have light alerting systems to alert the deaf patient to a phone call. When you have a deaf patient and you have them in a room, I suggest that you put closed captioning on the screen so they have access to TV, just as hearing patients do. You know, several patients coming into the hospital need IVs. I strongly recommend that you use the non-dominant hand to put the IV in. For example, I am right-handed. If you put the IV in my right hand, I won't be able to sign. If the IV is put in my left hand or my non-dominant arm, I will be able to sign one-handed. Vice versa, if I am left-handed, put the IV in my right hand. If you have to go into X-ray or a dark location, the patient will be unable to see an interpreter without using additional equipment. You could use a flashlight to shine on the interpreter so that the patient can see what the interpreter is signing. When an interpreter arrives, that's going to be great. Now, us as healthcare providers or administrators need to remember to look at the patient when we're talking. You do not want to talk to the interpreter, talk directly to the patient. Keep eye contact. The interpreter will interpret for you. You don't need to look at the interpreter. The deaf patient considers that as being rude. Also, when you talk with a deaf patient, try not to use terminology such as please tell him or please tell her that something's going on. Just talk with the patient directly. Where are you hurt? And the interpreter will sign that. Where are you hurt? When the patient responds, the interpreter will voice it as if they are the deaf patient. That way you can document what is needed. If an interpreter is unable to come for a while, you can use a notepad and paper to write notes. What's really important to remember is to keep it simple. Some patients might not have a good grasp on English. Some other patients might have a stronger grasp on English, so it really depends on the individual. If an interpreter isn't quite there yet, it's important for you to let the deaf patient know how long it might be until the interpreter will arrive and that the interpreter is coming. It is very important to let the patient know that because the patient might get the impression that an interpreter is not being provided and they'll get upset. If you write a note letting them know that the interpreter will be here in 15 or 30 minutes, that will help with the communication with the deaf patient. When you're talking with a deaf patient, lighting is actually very important also. You as a healthcare provider definitely do not want to have a lighting source behind you because the deaf patient who's looking at you and trying to see the interpreter who's beside you, they won't be able to see you. They'll have a shadow on their face. So you want to adjust to have a lighting so that you can see each other clearly. It's just like if you were a detective interrogating a suspect with a spotlight behind you, you would be all shadowed. If a patient needs to transfer to another hospital, it's important for you as a healthcare provider to contact the other hospital and let them know that a deaf patient is coming. That way they can have an interpreter ready and the transition to the other hospital will be smooth. Now, when you are working with a doctor or a specialist and they're making rounds or doing tests, try to coordinate schedules to best utilize interpreter services. This will help either the doctors from having to wait for an interpreter or having to schedule several interpreters throughout the day. Blue Ridge Healthcare has an approved list of interpreters who have gone through the appropriate screening. Caregivers are not to use interpreters who are not on this list, nor are they to ask children or family members to interpret. Caregivers can find this list of interpreters on the Blue Ridge Healthcare intranet under Communications, and then you would go to Directories. When an interpreter is working with a deaf patient, they will need to make sure they fit the communication mode of the patient, whether it be ASL, more of an English-based sign language, and at times the interpreter might need to get a certified deaf interpreter to assist in the communication. This is especially true if the deaf patient has minimal language skills. A certified deaf interpreter will help ensure effective communication. It's very important to provide interpreters off of the approved interpreter list. Blue Ridge Healthcare is committed to providing excellent care to its deaf and hard of hearing patients. Part of the commitment is compliance with the Americans with Disabilities Act. This applies not only to patients, but also to their family members. Not all deaf patients will need interpreter services. Some deaf patients might be able to speak for themselves. Don't just assume that the deaf patient can speak or that all deaf individuals need interpreters. Please ask what accommodation they need. That will help ensure compliance with the Americans with Disabilities Act. As I mentioned earlier, it is very important not to ask a family member or a friend or someone who is not on the approved sign language interpreter list to interpret. Blue Ridge Healthcare must follow our policy, which means you need to choose someone off of the approved interpreter list. Now, lastly, when you're working with a deaf patient and you have the nurses rotating schedules, it's really important to let the other nurse coming on duty that they have a deaf patient. That way they're ready to meet the communication needs of the deaf patient before you leave. We're done talking about deaf patients, and now we're going to focus on patients who are hard of hearing or have some type of hearing loss. Some of those patients might wear a hearing aid. When you think of a patient wearing a hearing aid, you might assume they can hear everything, but they can't. Some of them may only be able to hear environmental noises. Some of them may hear a voice but not be able to understand all the speech. Some of them may be able to understand speech. It all depends on their decibel of hearing loss. One thing that's really good to remember is to have a hard of hearing individual in a quiet location, such as if you're in an ER situation, there is a lot of noise. It might be hard for the hard of hearing individual to hear what's going on. So you would want to have a quiet location where you could talk with them. You also want to make sure that you have eye contact. They're going to depend on your facial expressions and mouth movements to help them with their communication needs. When you're talking with someone who has any type of hearing loss, make sure that you speak slowly and clearly. You don't need to exaggerate your mouth movements like, "Do you need to go to the bathroom?" No, just talk at a normal pace clearly. Do you need to go to the bathroom? Also, when you're switching topics, pause for a moment before moving on. Like, we are working on blood, like a blood transfusion or IV. When you're done with that statement, pause and then go on with the next statement or the next topic. A good thing to do is to give a patient with hearing loss fact sheets or frequently asked questions about their situation. Sometimes you might need large print materials to help them understand what's going on. By having these written materials, they'll be able to understand more about what medicine they need to take, what's going on. Also, try to be patient. I know that you are busy and you have a lot to do, but trying to accommodate patients with hearing loss does require patience and for you to slow down. Sometimes patients might not understand what you're saying, like if you're talking about what medicine they need to use. You can write that down. When you do write, make sure you are legible. That way the patient can read what you were trying to say. When you talk with the patient with hearing loss, don't think you have to get right up in their face. You don't need to get there. You just need to stand back at a normal distance. Ask the patient if they can see you clearly. They might tell you to move back a little or come a little bit closer. When you're in a location where you can talk with the deaf patient, please remember you don't need to holler or scream at the patient. Just talk normal and slowly, and the patient may be able to understand you. If you're still struggling with communication, you can write down some directions, or you could also use a power of attorney or a family member that might be able to help you communicate a little bit better. The patient might be used to their family members' mouth movements or facial expression or their tone of voice, and they're not used to yours, your mouth movements or your facial expressions. Especially if you have a male nurse with a beard or a mustache, that makes reading lips a lot harder. So there may be times that you need to call in another nurse to help with communication. What's really important, no matter if the patient is deaf, hard of hearing, or has any type of hearing loss, is to keep eye contact. If you look away, they are going to lose part of what you said. If the patient continues to struggle and misunderstand, try to be patient. To make sure they get the right information, ask them questions. If they're answering appropriately, then that's good. If they're answering inappropriately, try rephrasing the question or the information. If that's still not working, try asking somebody else to come in and having them say what they need to. It really depends on the individual as to what type of communication access they need. I hope you enjoyed listening about working with hard of hearing and deaf patients. There are a lot of tips that are the same. I know that you will be very successful in all that you do. Have a great day.